we currently have a PSA test for prostate cancer that picks up lots of prostate cancers, and we don't necessarily know which ones we want to treat, because some of them can be quite benign and some of them can be quite aggressive. So we wanted to look for another factor that might be present in the blood that could perhaps help us determine which of the prostate cancers we should be treating and which ones we may not need to treat. We conducted our research to try and identify some factors that might be involved in the development of prostate cancer. We know that growth factors, which we all have present in our blood, that make cells divide and grow, might therefore be involved in making cancers grow. So we wanted to see if we could find a link between a particular family of growth factors and prostate cancer development. And we particularly wanted to look in men who didn't have any symptoms of prostate cancer yet, so they were very early on in the development of cancer. We conducted a study where we looked at 2,500 men with prostate cancer and an equal number of men who didn't have prostate cancer, and we measured some growth factors in their blood to see if the men with prostate cancer had different levels perhaps than the men who didn't have prostate cancer. We found that we identified 3 growth factors in the blood that were in higher levels in men with prostate cancer than in the men who didn't have prostate cancer. We need to do a lot more on it. It's quite early days, but it means that potentially we've identified something, a marker of prostate cancer in the blood in men who don't have any symptoms of prostate cancer at all. At the moment, I can't say if that's going to be more effective than the PSA test, but it might enhance the PSA test.